Welcome to the Registry Insider. I'm Bill Cyclith, CEO of the National Registry of EMTs. And in today's episode, I'm joined by Michael Kaduce from NAEMT, National Association of EMTs, to have some conversation about what are the latest and greatest happenings from NAEMT's perspective. So, Mike, welcome to the podcast.
Thanks. I'm thrilled to have you. A long-time listener, first-time caller.
Great to have you. So for listeners who may not know, which there may be some, what is the National Association of EMT? What's your focus and purpose as it relates to the EMS profession?
Absolutely. So the NAEMT is the largest advocacy organization for EMTs. We represent EMTs all around the globe, primarily here in the United States. And we really have two main focuses. One is advocacy, ensuring that the legislation that's passed on the federal level represents EMTs and that EMTs and paramedics are represented in Congress. Making sure that the laws that are passed advocate for EMS. And then what we're probably most known for is our educational efforts. I think the biggest class we teach is PHTLS, but we have 170,000 students that take our classes every year. So I think whether it's advocacy or education, ensuring that we're providing the most up-to-date research-based classes, those are really the two primary focuses of the NAEMT.
Awesome. So advocacy and education, big role in there, global, not certainly limited to the United States. That's pretty cool too. So a little bit about the history for NAEMT. Obviously, the NREMT, National Registry of EMTs, and the National Association of EMTs, and AEMT, were both founded by Rocco Miranda.
Yep.
Our initial executive director for the National Registry and founder for NAEMT. So our organizations kind of come from the same tree, if you will.
Yeah. We celebrate a similar birthday.
We do. So what are some of the latest and greatest happenings with NAEMT? You talked about advocacy. Let's talk about that legislative aspect first, and then we'll go into education.
Absolutely. So probably one of the things that's most recently happened and fresh off the press that the listeners will be the first to find out about is this initiative that we've put forward called EMS Counts, which is, as you're aware, that we really don't know how many EMTs and paramedics exist because the way we count occupations on a federal level doesn't really extrapolate for fire departments separate from EMS agencies. It sort of just lumps them all together. The legislation that would separate that out and start counting EMTs and paramedics individually has passed committee and is headed to the floor to be voted on. So we're really excited about that. Fresh off the press as it just came out of committee. So
and that does have bipartisan support.
It does. So we're optimistic about that and where that goes. It all depends on advocacy and memberships. But beyond that, we're also advocating for an increase in the Siren grant funding. So that is to increase retention and recruitment for EMS providers and fire departments throughout the country, with a primary focus on improving retention and recruitment in rural areas. The listeners may remember that that's passed annually. We've asked for an increase in funding for that, recognizing that $32 million is what we want this year. You divide that up amongst all the rural, super rural areas, and that's a little bit of money for each agency. So increasing that's really important. And then I think one thing that every EMS provider is behind is TIP, or treatment in place, where we can provide treatment for patients who don't necessarily need transport. So we're continuing to advocate for recognition of that by CMS and funding for that. So it's not just you call, we haul.
Awesome. And as EMS has evolved from a more traditional role that we were familiar with through the 70s, 80s, and into the 90s, it is definitely not the EMS systems that we know today. The systems today are not the systems that we knew 20, 30, 40, 50 years ago.
Absolutely. And I think that's one of the primary missions of the NAEMT. We have people who work on Congress or on Capitol Hill, primarily as our lobbyists. That's all they do is work for the NAEMT and for advancing EMS. So I think as we say, this isn't EMS in 20 years ago where sort of we just expected people to know what EMS was and know what we do. That's not the case. And I think most people do think we show up, we take you to the hospital. I think we know that that's not what the future of EMS is in entirety. It's going to have to be all of these different aspects. It's community healthcare as well. It's this combination of public health and community service and EMS all rolled into one. So having someone that can continue to educate Congress on what we need and what the advancement of EMS is incredibly important.
So what are some ways or methods that our viewers and listeners can go and find out more about? What are the happenings for NAEMT from a legislative advocacy perspective?
Absolutely. We try to make it as easy as possible. Our website is at naemt.org. There's a advocacy button on the top. They can click that and see the advocacy updates. The nice part about that is if they click on something, they can click on whichever sort of initiative they're most concerned about, or all of them. and it will automatically generate you a letter, and you put in your address. It'll tell you who your representatives are. You could automatically send your letter right to Congress.
So in addition to sending a letter directly to Congress, what are other ways that EMS clinicians, EMS professionals can get involved?
Absolutely. I think becoming a member is probably the first step.
Okay. How do they do that?
They can go to our website and they can become a member. It's a very easy process. There's an annual membership fee that goes to help support those efforts. All of that is done through our website. Again, that's what goes to help fund these advocacy efforts and initiatives. We spend a day on Capitol Hill every year called the EMS Day on the Hill, really advocating, meeting with Congress members, meeting with their staff, their advisors, really advocating for EMS. It's a great day. I think everyone knows sort of the iconic photo of everyone standing on Capitol Hill in front of the Capitol. But that's one of the other ways that folks are interested. We take care of scheduling all of the meetings with their local representatives so that you show up, we do a briefing, and then send everybody to
meet with the congressional officials and staffers.
Absolutely.
Awesome. So that's anything else on advocacy before we go to education?
We're continuing to keep pushing forward. Absolutely.
Awesome. We appreciate that as a profession. So from switching gears then to education, obviously you said that's one of the two things that NAEMT is primarily involved in, again, advocacy and now education. What are the happenings or latest and greatest as it relates to education?
Well,
NAEMT?
Being here at NAEMT is perfect because in about 3 weeks, we have EMS Expo, this worldwide conference, the largest conference of EMS providers. And one of the pre-cons, which is September 10th, is the World Trauma Symposium. So
tell me more about it.
The latest and greatest in trauma care. I think, again, we're widely known for the pre-hospital trauma life support class. So every year at EMS Expo, we try and make sure everyone knows what the latest greatest in trauma care is. And Dr. Doralek and Dr. Morgan, two of our medical directors and advisors, will be there helping lead that discussion, talking evidence-based practice, talking trauma care, resuscitation. So really bringing the best practices to EMS to the providers.
And that's a day-long event too, right?
It's a whole it's an 8-hour day. CE is available, and actually, we've done it in the past, but this year it's also live streamed. So for folks that can't attend the conference in Las Vegas, they can register on the website to attend and listen to.
So does that hit NAEMT.org? They can register for it, or
the NAEMT can get them there. They can also register at EMSWorldExpo.com.
Awesome. So that's with the Trauma Symposium, EMS Expo, World Expo is coming up. What other educational initiatives that come to mind for NAEMT?
I'm so glad you asked. I brought a list.
Okay.
There are enough things that we're currently working on, and most of these, I think the important is they're instructor driven. So our instructors and our members are coming to us and saying, we want this, we need this. So the PHSUS 10th edition, military edition, is working its way out. I think everyone knows PHSUS, but they don't realize there's different versions of it for different providers. So PHSUS rolled out a couple of years ago. Probably the one thing that the most of our providers have asked for is an update to EVOS. So the driving course. So that 2nd edition refresher is coming out. The AMLS 4th edition refresher is coming out, and the hybrid version of advanced medical life support is currently being conducted. So if folks remember, we rolled that out last year for the new course, new educational objectives, all of that. GEM's 3rd edition online course is coming up. So we don't have a lot of courses that are online asynchronous. Most of them have to be taught in person by an instructor, but we've gotten feedback that people would like to be able to provide these courses to their students, but don't have necessarily the instructor cadre to do it. So a couple of our courses, including GEMS, will be able to be rolled out in that fashion. So it'll be online, students can watch it, participate in it, and then take the exam at the end and get their certificate all online. And then we're working to update the refresher materials in our refresher series to meet the 2025 NCCP model. So a slew of things that are coming out in the background. For
awesome. So a slew or a plethora of educational opportunities, updates, and potential uses for a ton of people in the EMS community. So
absolutely,
for what you're doing for that.
I appreciate it.
So anything else from an educational perspective that you want to share with listeners?
I think we'd love to see as many people as we can at EMS World. We've mentioned the World Trauma Symposium pre-con, but the conference is jam-packed with all kinds of great education, whether it's ALS, BLS, educators, leadership. We have it all at the EMS World Conference. We'd love to see people there. And then probably one of the most exciting things that we just recently announced is the keynote for EMS World will be several of the responders that were at 9/11 in New York City. I believe we have one of the deputy medical directors and a couple of the administrative folks that were there from the FDNY EMS side that will be delivering the keynote, some of the lessons learned from September 11th. So really excited and really honored to be bringing them because the conference is during the week of 9/11. So really paying homage to our heroes in EMS and those that gave the ultimate sacrifice, and learning some lessons from how we can continue to evolve and improve the system.
Awesome. Very good. So we'll look forward to being at EMS Expo and hopefully the World Trauma Symposium as well. So,
absolutely.
Michael, I appreciate you spending time with me today and sharing the latest and greatest of NEMT, both from an advocacy and education perspective with our listeners.
It's an honor to be here. Honored to be able to partner. These are two great EMS advocacy organizations, and our partnership to continue to advance the mission of both of our organizations is incredibly important.
Thank you. Appreciate it. Thank you for what you do. Thanks for listening. And as always, stay safe. Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications of upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to nremt.org. Thank you very much. And again, stay safe.